it's Steph, and I am documenting my cosmetic procedure for Blepharoplasty with Browpexy. I am getting my procedure done tomorrow with a doctor that I found in Colorado Springs. His name is Dr. John Burroughs. I found him basically just by doing a lot of research and looking online. And first of all, I guess I realized that I needed to find somebody locally. And then I also wanted somebody who was more of an expert on the eyes rather than just looking up a general plastic surgeon. I wanted somebody who focused their practice on the eyes. So I was able to find him in his practice up in Colorado Springs. It's called Springs Aesthetics, and he is an ophthalmologist. I definitely would recommend finding someone who is either an ophthalmologist or ocular plastic surgeon, or you could even look up a facial plastic surgeon, just for the simple fact that especially when you're dealing with an area as sensitive as your eyes, you want somebody that is doing those procedures all the time, and not somebody that's doesn't really have a whole lot of experience with it, because you might have to then get it redone, or you may be unhappy with the outcome of the surgery. So I was fortunate to find him, and I met with him a couple times. I felt comfortable in how much experience that he has. There's a couple other reasons as well why I chose him specifically. I like the fact that I can get the procedure done in the office and not have to go under a general anesthetic where they put you completely under. I've never been put under before, and it costs more money to do that if you want to go and get it done at a hospital. So he actually does a local anesthetic, and just basically puts you on some different pain medication that just makes you feel more relaxed, and you're still I guess aware of what's going on. You're not completely under, but for a procedure like this that's only an hour or two is completely fine to get it done in the office. So that I do like. Also, the fact that he uses non-dissolvable stitches was important to me. If you are getting a blepharoplasty and they use dissolvable stitches, those are the ones that you don't have to go back for a second appointment, and they just dissolve on their own. It may be a good option, I guess, if you are getting it done out of state and you maybe don't necessarily want to have to go back. But other than that, I think having the sutures that they remove in the office on a second appointment is a better choice, because as I have read and researched, is that, and also what the doctor confirmed with me, is that the non-dissolvable sutures that you go back for a second appointment and get removed are better because it's less healing time, possibly less scarring as well. So overall, it's just a better option. And I think as well, just to have that second appointment with your doctor as just a follow-up to see how everything is healing is better. So the reason why I decided to get it done, it is something that I have been thinking about for probably about the last year. Just some different aspects of my eyes or my eyelids that were bothering me. So if you can see here, try to put a little bit more light on there. The eyelid here, it has a double fold on it, and it's just generally kind of droopy right there. And also just when I do my eye makeup, I'll be watching tutorials where they'll do the crease in the middle, and I don't really have that defined crease, so it just makes it hard. When I do put eye makeup on, it gets real dry and that crease is more defined there. It also affects the way my eyes look as far as the symmetry of it, because this crease here is a little more pronounced than that one there, and so it can make it the shape of the eyes look different as well. So along with the Blepharoplasty, I am also getting a Browpexy, and what that is basically the brows. When you get your Blepharoplasty done, it is a possibility that it can, by removing that skin, it can pull down on your brows. So most women want to have that nice defined shape that I think that I have now, and I do not want it to have it sagging down. I mean, the whole purpose of the procedure is to have a more brighter eyed look, and so I would hate to have my eyes open up wider but then pull the brows down. So what the Browpexy does is they use that same incision line, and they just attach your the brow, I believe, to the muscle. I'm not exactly sure, but it just holds it in place that way so it's not drooping down. It doesn't necessarily lift it, like if you were to go and want to get a brow lift. I mean, if I wanted to have a significant lift on it, then you would want to go and have a brow lift. It just is more so to prevent it from dragging down. It can lift it very slightly, maybe a millimeter or so, but again, the main purpose is just not to have it pulling down from the Blepharoplasty procedure. So I guess the final things that I wanted to say is that I would recommend definitely doing your research and finding a doctor that you feel comfortable with, someone that you can trust. I guess don't just try and go look for the cheapest one, because it is something that you have to live with the outcome of. Also, you probably want to find somebody local. If you are wanting someone that doesn't use the dissolvable sutures. So, just do your research, and tomorrow is my appointment. I'm a little nervous, but I do feel like I did the legwork, that I do trust my doctor, and I should feel happy with the outcome. So, wish me luck, and hopefully all goes well. Thanks for watching.